All right, I'm going to talk about key injury areas of the knee. And for this specific video, we're going to only talk about adult injuries, and there will be a separate video on child injuries. So when we talk about the forces that go through the knee, there is a lot because it's a weight-bearing bone and because the femur and the tibia are our longest bony levers. So we've talked about the longer the levers, the more potential for torque, and there's great potential for torque at the knee. So when we talk about areas of injury, we're going to talk about how in extension there's great compressive forces that go through the knee entirely. A little bit more force is going through the medial side than the lateral side. And then when we are in flexion, as you can see, the patella here rides in this groove. So I'm going to put it in a position where you can see the shape of the patella and the shape of the femoral of the trochlear groove here between the two condyles. So when we are in flexion of 60 to 90. So this is 60 degrees of flexion, 90 degrees of flexion. See that patella? See how much higher it's riding on the femur? There's intense compressive forces there, and that's where we get the most pain. So we'll first start with anterior knee. So all the anterior knee problems that we see are chronic and from overuse. It can be from a lot of different things, but it can be from muscle tightness, even muscle weakness associated with the quads, and also the quad to the hamstring ratio. And when we also like landing mechanics, sensory motor system of the leg, of the knee in general, from knee injuries and things that have happened, all of that affects it. So when we refer to pain just around the patella, we say patellofemoral pain, and it refers to just any pain in that area, and it has to do with that compressive forces. Additionally, we can have patella tendinopathy. A lot of people say tendinitis. Usually by the time we see pain or if we feel that it's thickening, it's beyond tendinitis. It's beyond that acute inflammation. And now it's either tendinosis of breaking down. It can be tenosynovitis, which is the sheath of the tendon, which is inflamed. So there's lots of things that can happen, and this typically happens in adults. Sometimes I think children are diagnosed with this, and it's something a little different. So we'll talk about that in the children video. But this is usually when the bone is nice and strong and there's no weak spot in the bone, the tendon will typically take most of that load. Moving to the medial side of the knee, when we talk about chronic injuries, there's a lot of force that goes through the medial side, this medial compartment. The medial side is bigger than the lateral side. Because of that, our body is designed to take on that force. So we have the articular cartilage at the end of the bone, and we have the meniscus to absorb shock. Both of these break down over time just from wear and tear. So that's osteoarthritis when it's the actual articular cartilage. And then with the meniscus, it breaks down and starts fraying and thinning out. When it frays and it gets rough surface, it actually can affect the articular surface. So it'll cause pain in the knee and also rough up the surface. So people will often get what's called a meniscectomy, where they'll go in and just shave this down. The thinner this meniscus gets, the less absorption you have and the more force going through the articular cartilage and the tibial plateau that the meniscus is sitting on. So both of these, it's very important. The medial compartment is the most likely to break down in most people, but it just depends on the anatomy of that person. And those are chronic injuries. You can also have acute meniscus tears, and this can usually happen even in young people, young adults. Children will usually have more of a chondral issue with, and I'll talk about that in the child video. So for adults, it's when we're having that compression and extension, and then we rotate and we twist, and we do that twisting. And with the medial meniscus, more so than the lateral meniscus, there's not much give there because this medial meniscus is attached to the MCL and the capsule. So it is kind of locked in that spot, and it doesn't give with that rotation of that twisting of the femur. So this is like if you're running and cutting directions really quick and you basically run and then twist like that can cause that tear of the meniscus. If you're really young and it's on the outer part of the meniscus where the blood supply is good, then you may have it just repaired to preserve the thickness of this meniscus, and that takes longer to recover. Or they just go in and shave it down, which puts you at higher risk for early osteoarthritis. But that often needs to be done because it's if it's in the inside, because it's a poor blood supply and won't heal well, or if you're older and you also just won't heal as well. And then we also have chronically pezanserine bursitis, which there's 3 muscles. Make sure you read about that in the module. sargent muscles, and they basically all three do different things. There's a lot of friction there and cause issues. On the outside, the same thing, the IT band attaches to the Gertie's tubercle, and it's a fascia that acts like a muscle, and it shouldn't be, but it does, and it provides a lot of lateral stability when it shouldn't, so it often is overloaded. It doesn't have the extensibility, the elasticity, or the ability to build a contraction like a muscle, so often it gets really, really tight and hard to intervene on. Both of those, pezanserine bursitis and IT band, are often in runners or people that are doing biking, running up hills, running up stairs, things that are doing a lot of knee and hip flexion since they cross both joints. Also, MCL and ACL are going to be covered in Injury Spotlight, so make sure you watch that video. But they are both associated with a dynamic valgus collapse, and they can happen, they typically happen acutely. They can be worn out over time with some chronic load, but typically they're injured acutely. MCL from like a tension, LCL or ACL, I'm sorry, from a shearing. And I don't get really into LCL, but LCL is just, there's a whole posterolateral corner that's complicated that really takes on an anterior medial injury to be able to push that tibia back, and it just really strains this whole posterior part. So it's a very complex injury. So just make sure you read the text, make sure you read the module, and if you have any questions about these injuries, please reach out.